Everybody, we're back with Sam and we're looking at his right AC joint. He injured it Thursday. They did a workup. They said that his ligaments in his AC joint were torn. They put him into a supportive sling and he said, hey, what can we do to help? And so what I said, okay, well let's literally do some body welding. If you've seen any of our YouTube videos and our patient testimonials, we have hundreds of them on our blog, Daily Dose Vitamin H, and we're also on Facebook. And what's happening is this joint right here, it's just sprung. It's not necessarily dislocated. He doesn't have a step defect, but he definitely has limited range of motion, particularly in the morning. He's really stiff. And so let's just go in and let's weld this together. And it's greatly going to reduce the healing time. Okay, everybody, we're just going to accelerate the healing process for a AC joint injury. This is Sam. He had the injury happen on Thursday. It is Sunday night here in the office, and we're getting ready to do this so we can get back to college. In our vitamin solution, we have some really neat natural vitamins, vitamin B12, 5% dextrose, a little tiny bit of vitamin C, magnesium, and then just a really neat sports injury homeopathic, and that's what's in here. And then we have our ozone. We did it's called the Prolozone technique. And so what we're going to do, we just come into the AC joint. We've already prepped and cleaned the area. Little pinch here, and we're just feathering it right down into the area. We're going to drop in about 5 cc's of a vitamin solution. We've helped so many athletes get back onto the field with a totally natural approach, not having to use cortisone, because what that does is it can injure the ligaments and it can hurt the bones. It's very effective for hiding pain, but it doesn't necessarily make the area heal. This actually really helps make the area heal in our clinical experience. And so we're doing one procedure right there. And go. Bam. Mother load. Bam. Mother load. We'll do the joint itself here. We come around here.
Oh, yeah, that one. That one's fun. Ooh, yeah.
Bam. Got it. And that's on there. Tell everybody.
I said it didn't even hurt.
Okay. And the next part, we're just going to come right down here in the front part of the AC joint, right here on the top part of the intertubercular groove, and we're just going in and we're just putting this vitamin solution all around those ligaments. And then we're using some oxidative medicine here with the right kind of gamma and about twice the volume of the vitamin solution. And so we've got basically the front part of the joint. It's a little stiff. It's going to feel like bubble wrap when he's moving, but it dramatically helps the healing process, and he's going to notice a big difference, probably not tomorrow but the day after, and it's going to make his rehab go a lot better. We'll follow up with him in 2 weeks. And you guys, that's how we do AC's joint separations, West Clinic style. This is Dr. West and Sam. We'll see you guys on the next video.